Welcome.
Welcome, Mr. Woods.
You hear me now?
Yes.
Yes.
All right, great. Good morning. How y'all doing?
Good. Hope you are.
Good. I'm traveling, so hopefully, and not in my usual locations. Hopefully, you can see me and hear me okay.
So far,
Okay. All right.
and thank you for participating in this session.
My pleasure.
This thing ever gonna end?
Yeah, 15 seconds before we get started. 9:59. Good morning, everyone. We'd like to welcome you to the Charlotte Post C-Suites Conversation. My name is Linda Johnson, and I will be one of the hosts today, along with Michelle Spears. I'd like to introduce you to our team for the C-Suites Conversation today. We have our publisher, Gerald Johnson, along with Herb White, our editor-in-chief. We once again would like to thank you for joining us in this conversation here. And before we get started, I will turn it over to our host, Michelle.
Thank you, Linda. Good morning and welcome. At this time, I would ask that you open your Q&A and chat windows, which are located at the bottom of your Zoom screen as diagrammed. If you have any questions, please type them in the Q&A and they will be answered throughout the conversation. The chat will only be used for the team to communicate resources about today's webinar. Thank you and enjoy and welcome.
Thank you, Michelle. And so at this time here, I'd like to introduce you to our publisher, Gerald Johnson. It's always a pleasure to have Gerald join us on our webinars, and he'll go over and share with you a little bit more about our organization. Thank you, and turn it over to you, Mr. Gerald Johnson.
Thank all of you for joining us this morning for an interesting conversation we're getting ready to have with Mr. Woods. Before we get started, I just want to talk about the Charlotte Post, the leading African-American media organization in North Carolina with publications in Charlotte and the Raleigh-Durham area. And we've been doing this for a while. The information that we're going to provide to you today through our webinar series of C-Suites, we're doing this at no cost to you, and that's what we like to do in terms of engaging and informing our community. However, we will accept donations and subscriptions if you would like to contribute in some way, shape, or form. The host will put in a chat the way that you can do that. And having said that, let's move forward with Herb White, Chief Executive Editor, kicking this program off. Go, Chief.
Thank you, Gerald. And very briefly, is in terms of, like Gerald said, C-Suites is an initiative that the Charlotte Post Publishing Company launched earlier this year with a singular thought. It was our intention to bring to our audience online and hopefully once COVID subsides to an acceptable level, maybe even in person, bringing together our audiences with leading business people in North Carolina. C-Suites is intentional in terms of trying to bridge that gap between executives and the people that they serve in terms of their businesses. A lot of times we think of CEOs as folks who are up here that are kind of just out of our reach. But what C-Suites tries to do is bring them to our level or bring us to their level and have that conversation in terms of what it means to be a leader in business and have them impart their wisdom and their experience so that others can get an idea of what it's like to be in the C-suite and to aspire to follow in their footsteps. And we appreciate people like Mr. Woods and others who come before him and those who will follow after him in imparting that knowledge and that wisdom to our audience online. And so with no further ado, we would like to introduce Mr. Woods, who is the CEO of Atrium Health, one of the biggest hospital companies in the country, and certainly the largest in the Carolinas. And welcome aboard, Mr. Woods. And we promise this will not be a grilling. It's strictly a conversation about your career path and the things that have led you to this point in your journey. So good morning and welcome aboard.
Good morning, Herb, and good morning to everyone out there. Good to be with you today. And also just thank you for what you do for this community, the Charlotte Post, to really educate, especially during these COVID, this past year of COVID. So I appreciate the whole team.
Well, let's get started with some easy questions here to start off with. And the place that I like to start is going back to where you were born and raised, and that's the beginning. And then we will walk through the career path of where you are now. And in reading your bio, it's a great walk. So start us off with where you were born and how you were raised.
Sure. Well, let me tell you a little bit. My father was born in a little town, rural town in Tennessee called Yuma, Tennessee, Western Tennessee. I think the population when he was born was about 300. And so he tried to get out of there as soon as possible, and he joined the Navy. And along his travels, he ended up actually in Rota, Spain, southern Spain, where actually, for those of you that are watching the Euro Cup, Sevilla is where my mother was born, about an hour south of that town called Jerez de la Frontera, one of the oldest Spanish towns. So they actually got married, and it couldn't have been a more unlikely couple. You know, some from Yuma, Tennessee, some were from an old historic town in southern Spain. And then as when they got married, and then they moved to Rhode Island. At the time, that's where a lot of actually interracial couples in the Navy would go there, and it had a robust Portuguese population. So I actually was born on a base in Providence. It's called Quonset Point, Rhode Island, but Providence, Rhode Island. And then we lived in there for a while, then in New Jersey, then ended up going back to Spain. And so really the most formative times in my young life, I spent 7 years in Spain as a child, from 4 all the way to 11. My mom's the oldest of 12, so we had very robust, and my dad's the oldest of 9. So every time when the family gets together, there's a lot going on. It's a big party. So that's the kind of environment I grew up in. My father, though, loved the blues, and I know we're going to talk about music a little bit. And my mom was all about flamenco. So I grew up in a family rich with music and noise and great food.
So where did you get your early education?
Well, I went, my father actually, when we left Spain, we went to outside of Philadelphia, and I actually ended up going to Penn State. Everybody, if you live in Pennsylvania and you're going to a state, and that's really one of the only schools I could afford, and so ended up going to Pennsylvania State University. I started off actually at a branch campus near the house, because I needed to stay close to home to, help my mom, and my parents had split up, help my mom, in terms of working. But then I ended up going to State College, Pennsylvania, and then got my 3 degrees from Penn State, undergraduate degree in health planning and administration. And then I got a dual degree in business and also health planning and in health policy and administration, both master's degrees, because I knew that as an executive of color, at the time, there was less than 1% of African Americans in the C-suite in healthcare organizations. So I thought I needed to load up on my education. And I actually was the first one to do, actually I helped craft the dual master's degree program at Penn State, MBA, MHA, and was the first student to go through that and did the crosswalk with the deans and everything like that. But that really, I thought, gave me a really good foundation for my career.
So what as in your early life, what directed you into the health arena? Or maybe it was during, like maybe it was after you got into college.
Yeah, well, the thing I say, the folks I grew up with, some of them wanted to be doctors, some of them wanted to be lawyers. Nobody knew what a healthcare administrator did, or so nobody had any sense of what that was. And I'm fluent in Spanish because my mother spoke to me in Spanish since day one. And I knew I liked business. So I thought I was going to do some type of international business. And I spoke to a professor, and he said, you're in luck. There's a career day on international business. And somehow, Gerald, I got the dates messed up, and I actually went to the healthcare career day where there was a local hospital administrator. And he said, healthcare is going through significant transformation, and we need some young, bright minds to really help us transform healthcare. And if you care about community, if you really care about community, being a healthcare executive is one of the best ways you can actually improve people's health and well-being. And so that really, after that one little mistake, I decided to join the undergraduate program at Penn State, Health Planning and Administration. At the time, was the largest in the country in terms of undergrads. And so, the rest is history, as they say.
Good. I'm gonna let her, I could talk all day. I'm gonna let her chime in here for a minute or two. So,
but thanks for that small crack in the conversation window. When you look at how the business model has changed for business in general, but especially in health, can you talk a little bit about how mentoring impacted your trip to where you are now? I mean, who were your mentors, and what was the thinking as you were coming up through the ranks that ultimately you would wind up where you are, or did it kind of take a different fork in the road, or what?
Yeah, Herb, I've always thought big and large, and I always knew from the day I became a undergraduate at Health Penn State that I wanted to aspire to really have as big an influence and significance of a difference that I could make. And I thought that was going to be as CEO of a large organization. So that was my dream from the beginning. Along the lines, I had some wonderful, what I would say, sponsors, more so than mentors. And my first job in a hospital was in a little rural town in Pennsylvania. It was Tyrone Hospital. The CEO there was African American, and he really, how he helped me, he kept giving me increasing big jobs to do. And at the time, I'd never had any experience in some of the things that he had me do, and it was my way of learning, and him really with him helping guide me throughout it. The other thing he did, he exposed me to a lot of to his network, essentially. So I got to meet folks early in my career that I might not have otherwise met and formed a relationship with were it not for him. And then I also had, later on in my career, I worked for one of the largest health systems in the country, Catholic Health Initiatives. and the CEO there, Kevin Lofton, they're both dear friends to today, also really put a lot of faith in me and kept giving me more areas of responsibility. And that's how I kind of developed and learned and grew. The other thing I will say, though, we talk about white allies these days, and I had a number of folks coming up, also that white males that really also showed me the ropes and gave me opportunities. So I've been blessed with a lot of folks helping me throughout this journey.
And to that end, when you talk about allies, and I want to shift gears just a little bit and talk about history and the history of healthcare and those gaps, especially in the African-American community. Everybody knows about segregation in the South and how it was certainly unequal in terms of how Black folks were treated. And when you look at today, with yourself leading a company like Atrium that has its own history with Black folks, do you look at that as a way of saying, times have certainly changed, but also the mindset in terms of leadership and the people who are left with the charge, the responsibility of improving not only healthcare, but health outcomes for folks?
Yeah, I think that's a really important question. I mean, I think, first of all, obviously the board here 5 years ago decided to hire me first and foremost because they felt I could do the job, and that's always the important thing, but also because they knew, given my background, that social justice has been always something that's been part of who I am, including when I was chairman of the American Hospital Association, which is the lobbying organization for 5,000 hospitals in the country. I started a national sort of movement around health equity, so they knew that came to it as well. And I think that's why they brought me on. If you look at our mission, is to improve health, elevate hope, and advance healing, and for all. So when I first came here, that for all part was the most actually inspiring part of the mission. And I'm so proud of how we have 70,000, we call them teammates now. The for all is something that they really embrace. And the board, led by Ed Brown, who helped Hugh McCall build Bank of America, and also it was CEO of Hendrick Motors for about 14 years. He also brings some really deep passion to that. So when you have a CEO and a board chair and the rest of the board that really are looking to do things different, and to your point, right, some of the wrongs, Herb, that we all know have existed, I think that's been a powerful combination. And it showed up during COVID. In the middle of COVID last April, when we saw in West Charlotte, in the Crescent area, that there were disparities in testing, for example, it was all about action. It wasn't about words at that time. So we loaded up our roving vans. We worked with the church communities. We went to the parking lots there, and we made sure that those testing disparities were eliminated, working the same thing with vaccines. So I think we have a powerful mission that I think from the board throughout the organization feel it, have internalized it. And I think there's so many things that I'd point to during this COVID time that showed that it's more about action than words, including the thousands of courageous conversations we had when George Floyd was killed throughout the organization. I think it really, it's a culture that's ready to continue to grow and be the lead organization in the country for social impact, starting with our communities, but also we believe that we can be a national model. We were just recognized recently by the American Hospital Association for healthcare equity for being the premier organization there. And then last year, the federal government recognized that through Centers for Medicare and Medicaid as being the leading organization in the country on health equity. And that's great. Recognitions are good for us. Is okay, what are we going to do next to help eliminate the disparities that exist throughout our communities?
So when you first came in to Atrium, how much of it was, let me put it this way in terms of answering the question before I ask it, but Atrium has taken a path that really progressive path, and it started that prior to your leadership, but under your leadership it's sort of accelerated. So how much of the strategy when you came in did you follow, and how much of it did you sort of put on your own path?
Yeah, that's a great question. And to your earlier point, Atrium has been blessed with strong leadership for a long time, and so I came here knowing that it was a great platform to build on. The questions I asked the board during the interview process was, are you looking to just continue the path, or are you looking to really, healthcare is going through some very, very significant changes, and I think over the next 5 years to the decade, it's going to go through changes we can't even anticipate at this point. And that's putting COVID aside because we couldn't see at that point. So they said that, you know, we really want a CEO that's a change agent, that's really having us change faster than the environment. There's a quote by Jack Welch that if you're changing slower than the external environment, then irrelevance is near. And so we don't want to be irrelevant. We want to be the most relevant. And so I think that I came here with the board's blessing on a pretty significant change agenda that included expanding beyond North Carolina, that included, you know, some of the things that we're doing now, partnering with an academic health center and university like Wake Forest School of Medicine, and building a medical school, the first medical school for Charlotte. We're very, very excited. Innovation district. So I think I applaud the board because they really said, let's just not go incremental from the successes we have. Let's go ahead and be the organization that leads in this transformational moment.
So you feel very good about the leadership that the hospital is taking.
I feel extraordinarily good. You know, there's always work to do. So every day I get up saying, okay, what's next, and how do we continue to advance? But from the board through my leadership team, it's just everybody's committed to health, hope, and healing for all. And it's not just words on some paper. It's really something that gets us up and gets us motivated every day.
When you are the leader of a billion-dollar company like Atrium, obviously there's a lot of scale, a lot of size. How important is it as the leader of this organization to be nimble in terms of your thinking and trying to stay ahead of the curve? I mean, is that where the rubber hits the road in terms of leadership these days? That's
such a great question. Absolutely, because if you are, and we're a $12 billion organization, if you get bigger and slower, that's not gonna work in today's environment. So agility is really critical, and it has to do with how we make decisions. I'll give you an example. You know, in the middle of COVID, when things were really peaking, we were running out of bed space, and we knew that we had maybe 2 to 3 weeks maximum before we would fill up all our beds. And so a group of my physicians came to me and said, we got an idea that we can care for patients at home with COVID. And we've got the monitoring systems, we've got the medics that can go into the houses, we've got everything. So we'd like to go ahead and give this a try. And so within a matter of a couple of weeks, we had made a major decision, like providing care for COVID patients in their home safely. And we've seen about 80,000 patients now at home. So the ability for being a large organization to make decisions that quick is really important. And I always, my goal is, and we'll continue to grow, is to, no matter how large we get, to make it have a, for lack of a better way of saying, a small town feel, you know, so that people know each other, and we build different forums for people to connect. And my team knows no matter where they're at in Georgia or anywhere, if they need to talk to me, I'll typically get back to them the same day or the next day. So I think we really aim to have that agility and that community feel, if you will, internal.
Now, as a corporate leader of color, your path, what type of roadblocks did you run into getting from where you were to where you are now? Yeah.
Well, I hit the roadblocks that you might imagine I have in terms of opportunities that I felt I could do a good job in being denied because of how I look. I remember one of my very first internships that a CEO had recommended for me in a large, very nationally known organization. I'm not going to mention the name, but when they saw me in person, they decided that internship that was open the day before had been filled. And I also remember early in my career being told, and I kind of appreciated the honesty, went through an interview process. It would have been my first CEO job. And they were quite clear that you're the best candidate, but we can't have someone like you running this organization. And so, and actually, you know, I did appreciate their candor. My thought was, well, why did you put me into the mix to begin with? But that's a separate thing. But you know what? None of those experiences at all made me bitter. It just fueled my resolve. It just fueled my resolve that, okay, I'm going to outwork you. I'm going to do what I need to do to overcome. And that's really, those are some of the experiences that you have that make you stronger, I think, you know. So, and fortunately, I had people helping me think through some of those things. When we could take the next hour talking about some other things, but the main thing is, I would suggest it's unfortunate, but if you stay on the fuel your passion and you're going to show that you have what it takes, I think that's at least that's the path I've taken.
That's work for you, I think so.
So there was a question in the Q&A. How will Atrium leverage innovative technologies in the delivery of healthcare services?
Yeah, and that's a great question. Now, the one thing Atrium has been, you know, there's a lot of talk about telehealth and virtual health during COVID. We've been a leader in the past decade. So in that, so when COVID came, we didn't have a big learning curve. Our physicians already knew how to operate in that environment. But one of the most exciting things is, you know, we talk a lot about the medical school that we're building in Charlotte that will open in 2024. But around it, we're going to build what we call an innovation district. And we have, if you go to, for those that have been in Winston-Salem, they had those old R.J. Reynolds tobacco company buildings that they converted into innovation. So you've got these companies working, about 90 companies there, working alongside with medical students and scientists and clinicians trying to invent sort of the next cure for whatever disease. We're going to bring that same innovation district to Charlotte. And I think that's going to be a great laboratory working with some major companies so that we're creating new ways to cure right here in our backyards.
So how does that process get funded? Atrium's picking up the entire bill for that? Are you bringing in partners? How's that going to work?
Yeah, we're going to work with partners. And we already own the land, so that's the most important part. And we have businesses that we're talking to. In fact, on Friday, spoke with a big Fortune 100 company who are looking to have at least a plant or some plant a flag on our innovation district. And obviously, then they will pay for leases and they will do that. So we've got a pretty sophisticated and complex economic model. But we think that the thing I'm really excited about is by 2040, we've had an independent analysis showed that we will be creating 60,000 additional jobs in the region that either are going to be employed by one of these companies or are going to be helping us with the innovation of the medical school or some of the other components that we're going to have. So I think this is going to be really good for Charlotte, certainly from a health, from a technology, but this is as I was speaking with Governor Cooper not too long ago, this could be one of the largest job creations initiatives in the state of North Carolina. So we're very excited about that, and specifically excited about how we intend to reach out to those disaffected youth to drive really economic mobility as part of that job growth initiative.
We have another Q&A question here. There are several. The AHA is the leading member of PAHCF, the Partnership for America's Healthcare Future, the most powerful lobby opposing any healthcare reform, along with AHIP. Trying to memorize some of the, as a former AHA chairman and one who advocates healthcare for all, especially BIPOC, do you believe that nonprofit community hospital systems such as Atrium should align with PAHCF in resisting changes that will provide healthcare access to everyone, such as Medicare for all?
Yeah, I'm not really clear on some of those other organizations, so I'd have to be educated on their platform. What I do know is the American Hospital Association has a very transformative platform with respect to health equity with respect to social impact, with respect to Medicaid expansion, with respect to ensuring that as many people get access to insurance as possible. So that's I can't comment on the other two, but I can comment from the AHA platform and believe that every day they're looking to do the right thing by hospital providers in their communities.
Okay, and another one here, North Carolina will be rolling out healthy opportunity pilots across the state as part of the state's new Medicaid program. How do you see Atrium involvement in the new state's Medicaid program and addressing the social determinants of health?
That's a great question. Yeah, well, Atrium already is the largest provider of Medicaid in the entire state. So we're excited to see that more resources are going to be devoted to access points. We clearly, we have clinics in very challenged areas, and I think the Medicaid expansion, or I'm sorry, Medicaid reform in this regard, I think is a good thing for the state. And again, as the largest provider of Medicaid in the entire state of North Carolina, we have a vested interest in making sure that it works for the people that we serve.
Now, in terms of health, I mean, and everybody should be concerned about it, because if you don't have health, you've got the alternative, obviously.
Right.
But in terms of the public reaction, whether it's COVID or equity, as the CEO, are you surprised that at the level of engagement now with folks when it comes to health, as opposed to, in the old days, it was just you go see your doctor and the doctor does whatever, and that's the start and the finish of the relationship? Is today's emphasis on health equity and better living something that you embrace, or is it something that folks are still coming to grips with?
I think I embrace it wholeheartedly. I'm glad to see it. I'm glad to see that the conversation around disparities is really robust throughout, but also wellness, right? We want to keep people out of the hospital. And so, when I first started, I've been in this field for 30 years. When I first started as a hospital administrator, you really focus on what's going on inside your walls. Now, much more focused on what's going on outside of our walls, and really looking at people having access to telehealth, people having access to preventative care, but also, when we talk about social determinants, we have fed 50,000 kids for free, because if you can't eat well, you can't be healthy. We also committed $10 million to affordable housing, because if you don't have a warm roof over your head, it's hard to stay healthy. So we've gone even upstream to that to say, what are some of those social determinants, including transportation, that we need to continue to focus on to make sure that people stay out of the hospitals, which is our goal.
Okay. And I think we have another Q&A. Can you speak to any thoughts on bringing mental health urgent care to the region? It goes on, and would you, with that type of facility, offset the costs associated with behavioral health emergency room?
Yeah, another great question. We're actually the only health system in the entire state of North Carolina that has 2 behavioral health hospitals. So we manage behavioral health, and then also we have I mentioned telehealth. So we have physicians that can beam into doctors' offices or beam into our emergency room. So if somebody's there with a significant behavioral health matter, we have all the experts that can actually, because there's a shortage of behavioral health and psychiatrists in the country, and we were able to spread our 30 psychiatrists throughout the whole system. And so we're very much focused on that. We've been recognized nationally for that. 1 out of 5 people have a mental health issue that they're dealing with. So it could be your brother, your sister, your mother. And so for us, it's personal. And we continue to advocate for additional access for behavioral health, but we are recognized as one of the leaders in that space.
1 out of every 5, that means 1 of us on this.
Exactly. Daryl, what I say is, you talk to 4 of your friends, and if they're okay, then it's you. So I think that's the thing you gotta. But But we all probably know somebody who's struggling with anxiety, depression, things of that nature. We've also trained a lot of people in the community to spot this, right? Because I unfortunately, about 20 years ago, had a friend who I thought he was okay, and he ended up taking his life. And I was wondering, are there signs that I should have picked up? And so we're training community people in the community, in churches and other places, to say, this is the things that you watch out for, and also this is how you access help. And so that's a really important part of making sure that people get the help that they need when they need it.
And one of the other questions in the queue is sort of related to customer service and getting help. I have insurance, but need understanding of hospital charges. With whom is the best person to discuss and review those charges? Yeah.
Well, if they have a specific question, I can have, after this program, we can connect them with somebody on the team to kind of walk them through, and we'd be happy to do that. It's interesting because hospital economics and health system economics are so complicated. But just to break it down real quickly, like at Atrium, 70% of our patients are basically, the prices are set elsewhere. So Medicare, anybody has Medicare, the government sets the Medicare prices. Anybody has Medicaid, Medicaid sets the prices. About 10%, 15% of the people that we treat have no insurance. And so, a lot of times they pay what they can, maybe sometimes 3 cents on the dollar and things of that nature. So a lot of times people think the hospital sets all the prices. Actually, the majority is set by the government, but it's still complicated and it's hard to understand. We appreciate that. So I could have, we can make sure we can connect with the person and make sure we walk them through that.
Is that part of the job as well when you talk about the complexity? I mean, you go in and you're looking at a bill and it's like, where's all this stuff coming from? Yeah. Is that something that hospital systems need to do a better job of, or is that incumbent upon the government in the case of Medicare or Medicaid to help make it simpler for everybody to understand?
Yeah, I think it's part of everybody's job. It certainly is part of our job. And we work, we posted some prices online and things of that nature, but we still think it's a little hard to access if you're not in healthcare. But the federal government, we're a lot of times, we're just following what the regulations say that the federal government imposes. And that's why I believe in advocacy so much, because to have conversations with those who make the laws and those who regulate to continue to simplify things is really, really important.
So based on your career so far at Atrium, what do you see, or what are you working on in terms of future plans and driving the organization further than it is right now?
Yeah, we want to, there's a few areas that we've already kind of talked about. I think we can be the national leaders in driving social impact and reducing disparities of care. And I think that's close to all of our hearts, and it's really a focus of the board as well. I think we can be leaders in innovation. We just talked about the innovation district in Winston and also the one we're building in Charlotte. And I think we can, it's called translational research. So we want to make sure that what happens in the laboratory and the research can get into the clinicians' hands as quickly as possible to help people get better. We have, for example, one of the national leaders in regenerative medicine, Dr. Tony Atala. If you want to go on TED Talks and look at Dr. Tony Atala, you'll see how he basically grew a kidney in the laboratory, and it helped a young person with a new kidney. And so all of that exciting medical advances, we want to be leaders there. And then education. When we build this medical school in Charlotte, we want to make sure we have among the most diverse student bodies in the entire country. If you think about the African-American population, for example, in this country, it's about 13%, but only half of those that are medical school or physicians are African-American physicians. So we want to, through this new medical school and reaching out to Title I schools and other folks, really build a pipeline so that we can make a big difference in the number of physicians of color that we are able to train.
Okay, I hate to diverse for just a minute, but grew a kidney in the lab.
Yeah. He's growing kidneys. There's a 3D, if you go to there's a 3D printer. Both of my sons are engineers, so they had to get them 3D printers when they first came out. But they're printing ears and noses, so if there's trauma, they can replace those. So it's a brave new world out there, and we're going to be able to do that here in North Carolina as one of the national leaders. Now, what we're going to have to continue to work on when you talk about research, and that is the legitimate mistrust that people of color have had of research going back to Tuskegee and well before that. So we're also working at a grassroots level to say, continue to trust who we are, because we would not bring you the latest advances if we didn't think it was going to help you. And so we're going to be leading in research, but we also want to be leading in having that trust that the community says, if Atrium says this will work, then we trust them that it will.
And to that point of trust, there's another question. There's still a degree of mistrust of healthcare providers among the Black community. Is attracting more diverse physicians part of Atrium's strategy? And I know that there's also a lot of talk nationally in terms of having doctors of color in underserved communities. So can you kind of mesh those two together and talk about that?
Yeah, and to the point I just raised, through the medical school, we believe we'll be able to help grow and create opportunities for folks, people of color that want to be physicians, but also other allied health professionals that also are in the community, advanced nurses, degrees, other. So we're very focused on that. The trust, the thing about trust is, I think, you have to be on the ground, and it's got to be grassroots. And so when we talk about our relationships, especially during COVID, with the Black churches, with Latinx leaders, where we were providing vaccines and testing in construction sites, we went wherever they said there was a need. And I think those are the foundations of trust that we will continue to build on. So the community knows here, we're not just a health system over here and the communities over here. We want to be viewed as integrated into that community, including our physicians and teammates that look like the community that we serve.
And another question, what are some key areas of opportunity for small minority-owned companies to do business with Atrium that they or the general public may not readily think of or have knowledge about?
Yeah, and we actually, because of all the construction we have going on, and we have a big supplier diversity initiative. If the person who asked that question has a business and they want to learn more about some of that and how they can potentially participate, we'd be happy to also connect. But I think as much as anything, because we're building large, we'll be spending several $1 billion in investing in these communities. We also are worked on building capacity, because some of the smaller entrepreneurs of color, for example, sometimes they may not have the opportunity to really submit for a larger job. So we help them with that. We're going to pair them with other folks. So I think we've got a very active program, if you will, on how we continue to engage entrepreneurs and businesses of color in the work that we're doing.
Is that part of the strategy of building trust in those communities?
That's exactly right, Gerald. That's exactly right. Because ultimately, economic mobility is so important, and it leads to education, economic mobility. So that's what we want to. We are focusing on that, so that we're building wealth and income in communities of color. So that's ultimately the holy grail in terms of leveling out things, if you will. I also happen to be right now chair of the Federal Reserve of Richmond Bank, and so I've had a unique ability to see disparities in healthcare, but also in how wealth is distributed in this country. And so that's also been something that's given me a lot of insight in terms of ways that we can help going forward.
Now you serve in a lot of different places. Where you find time to do all of this?
Well, I don't. I sleep but about 3 or 4 hours a night, so that's about. So that's part of it. But also I have just a phenomenal team. I've recruited. I think it's the best team in the country. And so when you've got a fantastic team, you actually can do what you have to do sometimes as the CEO, which is make sure you are working with other national organizations to learn and to bring best practices back home.
Okay.
Another question. Do you personally believe that Medicare for All is the best solution for shortcomings in our present system, especially to address racial healthcare inequities?
Yeah, I think Medicare for All has a lot of different components. So there's a lot of different versions to that. So it would be what type of version are we speaking about? But here's what I do believe. I do believe that everyone in this country should have access to insurance. And that's really because we still have probably 35 million people that don't have access to insurance. And that's just fundamental to having healthier communities. So Medicare for All, there's different versions of that. There's some that I support. I certainly support expanding Medicaid, which has been a big focus that I think would have specific beneficial impact, not just on the urban poor, but also those living in rural communities. So I do support that, but fundamentally, we need to get everyone in this country insured so they have access to health care.
Now that's generally considered a political fight.
Yeah.
When you talk about Medicare for All or Obamacare, that kind of thing. As the leader of a health providing company, how much of that political fight do you inject yourself into? Because on the one hand, you're running a business. On the other hand, this is a political fight. So are you in a position to pick up the phone and say to your state senator or to your US senators, we need to do it this way, or North Carolina, you need to expand Medicaid? Yeah. Are you in a position to do that, or do you separate yourself from it?
Well, I have done it. So not only position, but I've done it. And I think it's how you frame the conversation. A lot of times I talk about, because we care about the same things, no matter what aisle of the politics you're in, a lot of times it's about your community, right? It's about the people who elected you. And so I start from the perspective of like, what's the best pathway to help the folks that you represent? In rural counties, part of the challenge is you have some hospitals that continue to close. And if Medicaid did expand, those hospitals in very rural areas might continue to be able to stay open. And there's nothing like a hospital closing in a small rural community that really then the rest of the town starts spiraling down. So I try to speak from those perspectives, and also those who care about, again, those in challenged urban neighborhoods, and start from what it is that we're trying to solve for, and then the different policy solutions that could meet that objective.
Interesting. Okay.
In terms of the future, nobody has that clear a crystal ball, but what do you see as the next great frontier for Atrium and for yourself as the CEO of the company? I know you've got the medical school that'll be online in 3 years. Yeah. That's a big deal because Charlotte's never had one before. Right. What is the next big thing? Is it something along the lines of technology, or is it something that's going to be more holistic, whether it's doctors in every neighborhood or whatever? Yeah.
We have a whole bunch of things on the drawing books that are really exciting. A lot of it is how we can deliver more care closest to where people live, right, or in their homes. So I think the way that care will be provided in your home is going through a revolutionary change, and we think we can be leaders in that regard. And a lot of that does involve technology. But we also, as I alluded to, we want to be known as the organization. No organization is perfect, but we want to be known as the organization that's really making a significant difference in people's lives, changing their lives, whether it be through health, whether it be through education, whether it be through how giving them economic mobility. And I think we're on a path to doing that.
So you're not talking about the return of the house call necessarily.
Well, you know, some of these ideas cycle through and they come back, and we have a lot more technology now for the return of the house call than we did, you know, some years ago. So you'd be surprised about how much of that could potentially still be now. It may be an electronic house call, maybe through your TV or through a different medium like this. But because we're already doing that now, you know, at the height of COVID, we saw 130,000 people we cared for through our telehealth platform, 130,000 in one particular month. So we were delivering care this way. So the learnings that we've had from COVID now, we're going to build that into our strategies going forward. So so it could be a version of house calls continuing, but with a lot more technology and capability.
Yeah. So what was old is new again.
Exactly.
At least we're not making any progress.
Yes. Hopefully we're making some.
Now, tell us about where we are with COVID right now in terms of hospitalizations and all of that, and for future pandemics or crises that come along like this, how well prepared do you think we are?
Yeah, well, I think, you know, if you think about just 6 months ago in January, the last week of January, we were hitting our all-time high numbers of COVID in our hospitals. And then that with the vaccine, and as you know, we led some of the nation's largest, most successful mass vaccination events. And in those, 30% of the people were of color. So I think vaccines really, really helpful. And have gotten in our hospitals now, COVID has been the lowest since the beginning. But we still have that variant. And my big concern, especially, and I would say this with people that look like me and look like you, is we really need to get the vaccine. I got it. I've recommended to my families. We're not where we need to be especially in the communities of color. And my concern is that if we don't get vaccinated, this variant could take hold, and then we're in a whole different sort of situation because it will continue to mutate. So I think we've made a lot of progress. The vaccine has been very helpful. My number one message, in fact, if you hear nothing else about what I say today, this past hour, is that please get the vaccine. We'll make it easy. If you have questions or concerns, we will connect you with our healthcare leaders and you can ask any question that you want. We'll show you the science, we'll show you the data. But that's my biggest, Gerald, my biggest concern now is not enough are getting vaccinated, and we don't want this thing to take hold again. We know the impact it has had in our country, and especially in communities of color.
It's already having an impact in other places across the world. So it can happen, no question about that.
Exactly.
And then to that, when you talk about the future, because pandemics come, and it's not like it's of course, COVID was a once a generation kind of thing, but there are others, whether it was Ebola or whatever else. What is the mechanism that's in place for that type of eventuality?
Yeah. Well, the way that we're wired to run to disasters as healthcare providers, not run away. And whether that be tornadoes, if there's a tornado or anything major hurricane around the Southeast, they're calling Atrium from a number of perspectives, including we have a mobile hospital that we take to those areas. I was in DC when the Pentagon got hit, and we were on the front lines. In fact, I have a picture in my office of the helicopter that we sent directly to the Pentagon. We were the first one on site. And so we're always running to disasters. COVID was no different. So I think just if you chose this as a profession, you know you're going to deal with something unexpected. And we've got a lot of smart people, a lot of committed people in Atrium and other healthcare providers that this was novel. They call it the novel coronavirus because nobody had dealt with it before. So we're used to dealing with the unexpected, and really we have the talent, and I think we have the team to be able to deal with the next version of the pandemic, whatever that might be.
Mm-hmm. And when you look at Charlotte, 20 years ago, it was a banking town. Today, it's more of of an energy town, a financial services town? Can it be a medical town?
It will be. I mean, it absolutely will be. We aim to make it that way. We're already known nationally in so many ways at Atrium, and we believe through this medical school, through this innovation district, and through the new care sites and that we're providing and the strategies that we have, this will be known as a healthcare town as well. And I think that's just good for the region. It's good for North Carolina.
Yeah.
Okay. And the other Q&A, and in a minute we're going to have to let you go because it's getting close to 10.
I'm sorry, I didn't hear the question.
Oh, I didn't read it. I started laughing. Any plans to showcase your musical talents soon?
Well, actually, I'm in the middle of finalizing an album, and the songs that I've written over the last 40 years, actually, a lot of them with a social justice message. It's interesting to go back on a song you wrote when you were 25, and it'd be about, some of the things that we're dealing with today. And so we're going to put that out probably in the fall sometimes. And I have some serious players. I've got the trombone player ran James Brown's band for a decade, and I've got the sax player from Charlotte who actually played with Prince. So I've got a whole bunch of who's who on the album, and it's been fun because it's been, this is the job that I do is 24/7, 365. So it's nice to every once in a while get to the studio and do something a little bit different. We talked about mental health. It's been very good for my mental health.
Well, now, see, I had no idea about this musical talent. This is another hour. I don't know how long you got. What kind of musical talent do you have? Because then the question, I didn't know this.
Yeah, well, people will find out when they listen to the album what kind of musical talent. And I'll likely donate all the proceeds to the foundation or the Healthcare Heroes. I grew up listening to blues and R&B and all of that. So if you think about, love the instrumentation like Otis Redding had. You always had background singers and big horns. So and a funk bass and drums. So that's the sort of the style of music, but it's all music that I've written over the years. And so I get a chance to actually put something out. I put some recordings out in the past, but this is sort of the only one that I've done completely, produced and with the vision I had for the album, working with GAT3. GAT3 is a local Grammy Award winning studio that actually produced the Babies album, and Rockstar was up for a Grammy nominated record this year. So I've got some great folks helping me do this.
So you had no inclination or desire to become a musician as a career?
I never did, because I had some friends that were doing this as a career, and to do music to put bread on the table is a whole nother thing. So I said, let me do this healthcare education thing, and then let that be a great hobby. But and it's been a phenomenal hobby. It's been part of my life, since 5th grade, actually. But no, I have no aspirations other than just playing with some good friends, playing some good music, and letting that be its own thing.
Interesting. You live and learn every day, I tell you.
So you have a preferred lane and you're staying.
Yeah.
We got time for one more Q&A, but here's one.
Oh, you want me to take that one? Or you
go ahead.
Okay, congratulations for graduating your first class of psychiatrists from the Sandra and Leon Levine Psychiatry Residency Program. Will we see more advocacy for mental health like this?
Absolutely. And we have been so blessed to have the Levine support us with the Children's Hospital, the Cancer Institute, and also behavioral health. And so, I think that was part. There's a shortage of, as I've said before, psychiatrists in the country. And so we're doing our part to change that.
And another question, it wasn't a question, it's a comment. Someone said the brother is bad on the guitar. So
Bad means good?
Yeah, bad means good. Hopefully bad means good. I have been known to play it behind my head like Hendrix, who I used to listen to a lot too. So I think, it's been a fun part of my life. And hopefully at some point people will get to see a little bit more of that and give me their opinions.
We'll have to bring you back and you can give us a performance. And we'll give you a personal review as well as your group.
Yeah. And is that and I know everything can lead to stress, or anything can lead to stress. Is this your way of letting off steam from this type of job?
Yeah, my biggest, you just named it. That's my biggest source of relief, because also when you're playing with musicians, they don't really ask a lot of questions about what your day job is. That's not the purpose. They want to talk about music and solos and the creative aspects. So you actually can, you can put that aside and engage with folks on a whole different level. And that's really what's kept me, I always say people need to bring their whole selves to work. And some people paint very well. Some people do spoken word. Whatever it is that you do, some people just walk in nature. I think that the jobs that we all have, it's important to make sure you have that as a way to de-stress. And that's been my way, and it's just been a lot of fun.
Interesting.
We will look forward to having some fun listening to it too.
Right. We'll let you know when it comes out.
Okay. All right. Sounds good.
At no charge.
At no charge. Well, remember, this money is going to foundations and to help people. So we might have to have you have a little charge so it goes to a good cause.
Well, if it's going to a good cause, then we'll be more than happy to pay whatever we need to pay. But I am. This was a great, interesting conversation with you. I want to thank you again for coming on and doing this. And I'm sure the audience is where I know I did, and I'm assuming the audience learned a lot from this conversation. And I can't thank you enough for doing it. And hopefully things will go well for you in the future. I don't see any reason why they wouldn't. And we will talk soon.
Great. Well, thank you again. Thank you for what you guys do, and I enjoyed spending some time with you.
Thank you.
Okay.
Thank you. That was excellent. I just want to announce we have a couple more C-Suites events coming up. The C-Suite Conversation in July with Fred Whitfield, president of the Charlotte Hornets. It will be Tuesday, July the 13th from 2 to 3 p.m. And also we will have Tunde Sadunde, president and CEO of Blue Cross Blue Shield. That will be Tuesday, August 1st from 1 to 2 p.m.
August 10th.
Oh, I'm sorry, August 10th. My thing is in the way. Okay, August 10th. That's correction. And any of these events you can see, it will be on our websites. We also have Better Sleep Simplified, which will be announced later on in July with Dr. Jason Wooden, which is an excellent event if you want to learn anything about sleep. And also we will have Black Lives Matter. That will be announced as well. And I believe it's in August. But you can always go to our websites, thecharlottepost.com or thetriangletribune.com, and get more information or register for these events. I want to thank you today. And here is our numbers if you'd like to call us. We're on Facebook, Instagram, Twitter, YouTube. And we will be, you have the phone numbers here and the websites. Thank you and enjoy the rest of your day.